I have the doctors in the studio this morning, Dr. Wade May and also Dr. John Patterson with the Cardiovascular Institute of the South, and to talk about a new aortic valve replacement procedure. And good morning, gentlemen. Thank you for joining us this morning. And we talked about this last week here on Spot 2 and also Meet Your Neighbor. And it's as a result of what kind of condition you have to have the surgery?
Well, aortic stenosis.
Aortic stenosis is a condition where one of the heart valves in the heart, there are 4 of them, begins to thicken, becomes restricted over time, and no longer opens fully, which leads to congestive heart failure, shortness of breath, fainting, chest pain, a variety of conditions. It's actually quite common, very serious problem. Critical aortic stenosis is worse than having cancer.
Tell us more about this procedure, and what is it called again?
It's TAVR, or a transcatheter aortic valve replacement, and basically what it involves is a valve like this is crimped down onto a balloon, which is on a shaft of a catheter that we can place in the artery in your leg, take up to the diseased valve, inflate the balloon, and it literally places the new valve there. This is done in an operating room. It usually takes a team of physicians to actually have this done, but it's less invasive than the open heart surgery that's traditionally been offered.
So who benefits from this?
Well, this procedure at this point is reserved for people who are felt to be either not candidates for open surgery because of multiple other illnesses or age, or people who are felt to be high risk, which is actually a pretty large chunk of people as you see that this condition becomes more prevalent with age. It's not yet something that's ready for every single person who has aortic stenosis. Many people feel they would rather have this condition, but it doesn't quite yet have the track record to recommend it for every single patient.
So where is this being performed, this procedure?
Well, up until very recently, in Louisiana, the only options a patient had was New Orleans or Shreveport, but recently Cardiovascular Institute of the South has partnered with Regional Medical Center of Acadiana, and it's now available right here in town.
Okay, if we'd like more information about this, what can we do?
Well, we can call 337-988-1585, or you can go to our website, www.cardio.com.
So big advances in medicine right here in Lafayette.
Absolutely.
Yes. Doctors, thank you very much.
Thank you.
Appreciate you coming in this morning. Back with more Spot 2, but before we go to break, let's